For the staff meetings, fabulous. Welcome, everyone. This is a fantastic turnout. Thank you very much. We do have a wonderful announcement to make this morning, so thank you all for taking the time to join us today. My name is Matt Anderson. I'm the President and CEO of Lakeridge Health. I'm going to be our MC for today. We do have a great announcement for us this morning. Some wonderful people who are joining us. And as you all know, it's an unprecedented time for healthcare across our region as we look to build our acute care system to better serve all of folks who are living across our Durham region. As a result of the growth that's going on and here in the municipality of Clarington and throughout East Durham, we see continued growth and continued need for expansion of healthcare services. Today's announcement recognizes that growth and the need to ensure that we have the right infrastructure and healthcare services in place to meet the needs of our communities today and into the future. Truly an exciting day for our hospital. We have a number of guests with us today. Today we're very pleased to welcome the Honourable Eric Hoskins, Minister of Health and Long-Term Care. Minister Hoskins is with us today to make this important capital announcement in support of health in our community. Joining us at the podium today will be MPP Granville Anderson for Durham, Valentine Lovekin, the Chair of the Board of Trustees at Lakeridge Health, Lewis O'Brien, Chair of the Board of the Central East Lynn, Chris Coy, Board Chair of the Bowmanville Hospital Foundation, and Eve Ann Reed, a community member on our Patient and Family Experience Advisory Group and a 15-year resident of Newcastle. As you can see, lots of people wanted to come to share in this exciting announcement. We also have with us, as I look around the room, another board member, Carrion Fenn. Is Carrion here? There's Carrion. Thank you, Carrion, for joining us today. Also wanted to recognize Deb Hammonds. Where's Deb? There's Deb. Deb is the CEO for I was going to say the wrong Lynn. Look at that, eh? I've only been here a year. I'm still working on it. The Central East Lynn, sorry. We also have sitting up front here our mayor. Wonderful. Thank you for joining us today. And also from our community advisory panel, Sheila Hall is here. Where's Sheila? Thank you for joining us, Sheila. David Penny is here. Thank you, David. And Doug Allingham. Where's Doug? He's hiding in the back. Thank you, Doug. Also from from Durham College, Don Lavisa. Don, thank you for joining us as well. Okay. Who else have I got to thank? From our Patient, Family, and Advisory Committee, Laura Abbasi. Laura, where's Laura? Laura, thank you for joining us. Members of our senior team, in particular, just want to call out Dr. Tony Stone, our Chief of Staff. Where is Tony? Oh, he's over there. Hi, Tony. I think does everybody know Tony? Everybody knows Tony. I know, exactly right. Also with us is Susan DeRick, our Executive Vice President, Chief Transformation Officer, who's joining us today. Tom McHugh, our Executive Vice President, Patient Services and Regional Vice President for Cancer Services. Thank you, Tom. And Colleen Wilkinson, our Interim Chief Nurse. Where's Colleen? There she is, hiding in the back there. Thank you, Colleen. From the Foundation Board, I've already mentioned that Chris Coy is going to join us at the podium. Kirk Kemp is here. Kirk? No? In the back? All right, hiding behind the pillars. Fiona Hodkinson. Hello, Fiona. Brenda Miller. Hello, Brenda. Jim Story and Bob Malone. Okay, we've introduced Adrian Foster, our mayor. Is Willie Wu here, our regional councillor? Where's Willie? There you are, Councillor Wu. Great to see you. And Gord Weir, our fire chief. Where's Gord? And Gord is in uniform today. I like that very much. Thank you, Gord. It's all for the pictures. It helps a lot. All right. Oh, Councillor. Wendy Park. Oh, very good. Hello, Councillor. Sorry about that.
Councillor Hooper's at the back.
And Councillor Hooper is at the back. Thank you very much.
You might as well keep going, Matt. There's only 4 people.
Yeah, I know. That's true. That's true. Well, if we made everybody stand up, the 3 people still sitting would feel uncomfortable, right? All right. So with that, maybe we can get this started with MPP Anderson, if you could come forward and bring greetings.
Thank you, Matt. Good morning, everyone. It's so wonderful. I didn't have much sleep last night, so so bear with me. So it's such a wonderful day for us here. I'm going to take credit for the great weather outside as well. We could have had this outside, couldn't we? Probably we should have thought about that, but I should have told you beforehand how great the weather would be. Right? So it's always wonderful to make great announcements such as this. And especially according to Mayor Foster, we make these on Fridays. It has been an ongoing theme that we make these great announcements on Fridays for some reason. It just happens that way. So Fridays it's always great when it comes to announcements, and we have done a few of them, and the mayor has always been there as a great supporter. But today stands out. It's especially great. It's one of the highlights of my career being a representative in Durham, and it's really a proud moment for us all. Just a few months ago, there were rumors that these hospitals would probably be closing. I have lived in Durham for over 30 years, and I know how important the hospital is to this community. My mom, when she was alive, made many visits here, and I can tell you that the quality of care is outstanding. In spite of the constraints, space-wise, etc., there was never any doubt about the quality of care anyone that came to this hospital would receive, and constituents tell us day in, day out that one thing they get first, compassionate care in this hospital. So it's something the staff should all be proud of. But despite the naysayers, rumors and protests have kept focusing on the close of this house, and that was never an option. You know, it's wonderful to deliver this, and it's a collective effort, as you all know. As I look back over the past 4 years, I've been successful in securing a number of vital files, but to me, close to my heart, none is more important than this one. From the GO train extension to Curtis and Bowmanville, to the 407 expansion, the Darlington refurbishment, the tens of millions of dollars invested for new school and child care spaces throughout Durham region, and especially in the riding of Durham. Durham has been enhanced significantly since we have taken this position. Our community is home to 4 of the top investments throughout this country. So that's wonderful. And here we are today at the Bowmanville Hospital announcing yet another massive project. But of course, the credit must be shared, as I alluded to earlier on. There are many key players who have played important roles in making today happen. First, I want to thank Mayor Foster again for his support. Adrian has been by my side, both as a colleague and a dear friend who I've known since 2003, I believe. That's when we started campaigning together. He was running for council then, and I was running for school board trustee at the time, and the friendship developed, and we have become very close friends, and that friendship continues. And he's a great supporter, and we support each other to build our community up. So thank you again, Adrian. On the hospital end of things, I've had the pleasure of working with not one, but 2 wonderful CEOs. Both Kevin MP. Is Kevin here today? We did invite him, and he was going to try his best to be here. And of course, Matt Anderson, who spoke earlier. Matt has been very vital presenting the case for the hospital expansion and helping to push this wonderful project forward. Also on the Lake Ridge team, I must acknowledge the wonderful fundraising efforts of the Lake Ridge Health Foundation. They work tirelessly to raise awareness and funds for the Bowmanville Hospital, as many of us know. And this project is going to need the community effort now more than ever, and they will be out there trying to raise funds, and I'm sure the community will put their best foot forward to make sure the funds are there to make sure this expansion be successful and you have a wonderful hospital in our community. So I encourage you all to support them, as without their effort, we would be where we are today. So thanks to the foundation and all the volunteers and all the people who have helped to make this such a wonderful hospital, and the best is yet to come, as you will soon hear from the minister himself. So I would once again call on individuals and organizations to come forward and put your best foot forward and donate to this wonderful cause for our community. But I want to end off by thanking my friend, Minister Eric Hoskins. Dr. Hoskins has been instrumental in helping me to deliver for Durham, along with our Premier and the Premier's office, because this couldn't have happened without their support and their belief in what we're doing right here in Durham. Just last month, his ministry has announced that we are developing Glen Hill Strathaven, a $36.4 million investment that will bring 125 new long-term care beds to Clarington, as well as a brand new facility. And that was just announced a few weeks ago. So thank you again, Minister. And we worked very hard to make that happen as well. Every day at Queen's Park, I would tap Eric on his shoulder and ask him for his help. And as I do other members, because I need the support of the collective caucus and ministers at the table to support this project. But Eric was special. I don't know, he might have grown tired of me, but I would never know it. Yeah. And you know what? I've been doing the same for the Bowmanville Hospital over a long time. This isn't that happening now. This was something that I wanted to do since I got elected, because I know how vital the hospital is to this community. I have lived here for over 30 years, spent my life here, most of my adult life, right here in this community. So it's near and dear to my heart as well. So I am delighted to have the minister here today to make this important announcement. So without further ado, please join me in welcoming my friend, Dr. Eric Hoskins. Thank you.
Well, thanks, Granville. Well, first of all, good morning, everyone. And it is true, if there is an award for the most persistent MPP, by far, I'm being brutally honest here. There is no other MPP who has been as persistent, as dedicated in coming forward and working with me, but reminding me on an almost daily basis just how important this project is. He has been a true champion of the residents of Durham and for the Bowmanville Hospital. And we're really seeing the results of many, many people's hard work and dedication and commitment over many, many years. But I want you to have confidence, as you should, in Granville's strong representation of this region and of Bowmanville and Clarington and Bowmanville Hospital. He has been relentless in championing this project, and I'm so honored to be here with all of you. And you know that oh, maybe I'll just throw in a plug for Matt. If you don't know Matt or don't know him well, despite the fact that he gets the name of the Lynn wrong, still, but
I didn't get it wrong. I was about
you just paused. You know. And I know you've got roots here, which is part of the reason why you were so excited to take on the responsibility of CEO of Lakeridge Health, coming from William Osler, the other side of Toronto. And but Matt is absolutely one of the best, and may even be the best, hospital CEO in this entire province. And I know it's going to get me into trouble with a lot of other people, but it is. Yeah. Well, I'm sure somebody got it. Yeah, they're running out of the room now to get me into trouble. But you know, with Granville as your representative. And with Matt as hospital CEO, and with Lakeridge, I know having such a strong board and governance, and with the mayor, who I know has been such a strong supporter of this project as well. And you add to that what do you have, 1,500 volunteers through the Lakeridge system, and a couple of hundred of them here in Bowmanville, and the staff who are so outstanding, as Matt can tell us and others can tell us, and anybody who's had to utilize the hospital system across Lake Ridge, whether it's the doctors, the nurses, the physiotherapists, the occupational therapists, the support staff, the management and leadership. At every level, you really are fortunate to have a hospital system and a network which is strong and delivers that highest quality of care to the residents of this area. And it's important to say that has been delivered in an environment in a region which is growing. And Bowmanville, I think, in this hospital is a perfect example of demonstrating how you've outgrown the physical resources that exist here in this space. As wonderful as all those pieces are, those human resources, we need to make sure that the physical space keeps up with the needs of the community and the growth of the community as well. And so it is, again, it's wonderful to be here with you. And I just, I've got kind of the easy job to take all that good advice that we're receiving. There was a planning grant that was given to Lake Ridge Health a couple of years ago, just over $2 million. But it was I think the wisdom of the Lake Ridge board and others, and Matt and others, that realized that Bowmanville had to be seen uniquely and had to kind of be seen in the context of the overall regional plan for healthcare, but to be pulled out as well because the needs here are urgent. And so those needs and that realization that we needed to sort of move Bowmanville more to the front of the line is the reason why we're here today to make this announcement. I was born myself. I understand the tremendous importance of community hospitals. I was born into one, Norfolk General Hospital, the other side of southern Ontario, near Lake Erie, in the town of Simcoe. But growing up and living in a small community that depends on a quality community hospital, I understand the role that it plays, which goes far beyond healthcare as well. It's an extremely important employer within the community. There's an emotional attachment, as there should be, to a community hospital, and it's often an important attractant for new people, new residents, new families to want to come to an area. They want to know that the health services in the area that they're considering moving to, that those health services are of high caliber. So that bond is important, that the role that a community hospital plays is an extremely important one. So, and, as an interesting aside, and Matt knows this as well, my brother has worked for Lake Ridge Health for about the last 25 or 30 years. He just retired last year as a lab technologist. So it gave me, through his eyes, it gave me and his experience great insight into the great work that is being done through Lake Ridge. So I know I'm through all that rambling tangent. I'll get to the point. Thanks for your patience. We have 16 more speakers, and we have a cake, which is. But in order for a hospital to be truly effective, it needs to be able to, as I sort of hinted at earlier, it needs to be able to meet the needs of the patients that it serves. And we know that those needs, what a community needs, that they change over time, just like communities change. And so our hospitals need to be able to adapt and change and keep up with that. Here in Bowmanville, you're seeing more and more people come through your emergency room than ever before, more than it was ever built to accommodate. And we want to ensure that those who rely on the Bowmanville Hospital will be able to continue to do so well into the future. So I'm here today to announce that our government is moving forward with the redevelopment and expansion of Lake Ridge Health's Bowmanville Hospital. We're committed to it. You can see the picture right there, the design, and we are funding it. And with this investment, the capacity of this hospital will approximately double in size. And that is a tremendous expansion. And we're frankly, investing in this site in Bowmanville Hospital to ensure that the residents of Bowmanville, the surrounding region, Durham region, that those residents, those families continue to have access to that high quality care that they are receiving now and will continue to receive into the future, right here in your community. And this project, as many of you know, will see a new hospital patient tower built to replace the old north wing. It will be state-of-the-art and will serve the community well for many years into the future. And through new construction and renovations, Lakeridge Health is going to renew and expand the existing facilities here at the hospital. There'll be, as is badly needed, there will be a completely new emergency department, which will be able to deal with the growing needs for emergency care. There will be new surgical services, new inpatient units. So now, with this redevelopment, more surgeries will be able to be done right here in the community, meaning patients are less likely to have to travel to get the services that they need. And that's what people want, and that's what people deserve. The plan also calls for new and expanded diagnostic imaging, which will help the hospital to better diagnose and identify challenges that patients have so they can help those patients better. And this project is so important, as I mentioned, to the community, but it's also a reflection of our government's commitment to putting the needs of patients at the very center of our healthcare system, and always looking at what we do through the lens of the patient, the family, the caregiver, the community, and see what we can do to provide the highest quality of care, but also as close to home as possible and as seamlessly and as coordinated as possible. That's what any of us want. We want a healthcare experience that gets those positive outcomes, and we have some of the best outcomes in the world here in Canada with regards to healthcare. But they want that in a way which is as convenient as possible, as seamless as possible, and as close to home as possible. In fact, over the next 10 years, as a government, we're going to be investing $20 billion in capital infrastructure alone, let alone the operating costs of our hospitals, but to build new hospitals, to renovate hospitals, to redevelop hospitals, to expand them like we are doing here in Bowmanville. It's the largest investment in hospital capital infrastructure in the history of this province. But it's necessary. It's necessary because healthcare is changing, our hospitals remains vitally important, and our population is both aging but also growing. So soon this community is going to be able to see with your own eyes the kind of difference that these investments will make in our province. But most importantly, I want to thank and congratulate all of you who have been so dedicated and so committed to this cause, to your hospital, to your community, that this is a reflection of your hard work. And we know that it will not be long in the future that all the residents of this area are going to be able to enjoy these new services and this new wing, the patient tower, and the new facilities and services that go along with it. So congratulations, everybody. Thank you.
Hello, everyone. I'm Valentine Lovekin, the board chair, and on behalf of the trustees and the entire Lakeridge community, I want to say how thrilled we are by the minister's announcement. It's a wonderful day. It's a wonderful announcement, and it was a wonderful speech because it preempted most of the comments that I had to make. I'd also like to say that not only am I thrilled, but I also am very hopeful. I'm hopeful because there's so many of us in this room, and the temperature is slowly rising, that the minister won't have to demonstrate that he is actually still an active practicing doctor. I am reflecting about what this means to this community. And in East Durham, we have a proud tradition of excellent health care, and that means a lot to me on a personal basis. It was 97 years ago this March that my father was born in this hospital. And when I was thinking about how the Bowmanville Hospital has provided care to my family, I could count 5 generations that have been served here. So this means an enormous amount to me. It also means an enormous amount to this community. But it also means something more than Bowmanville. It means something more than this immediate community. And that speaks to the mission of Lakeridge Health. Lakeridge Health is not a hospital, it's a healthcare system. And the announcement that you've made today reinforces that Bowmanville is an integral part of that system of care by which we provide care for people throughout Durham region and neighboring regions. And it's an affirmation not only of this site, but it's an affirmation of Lakeridge Health itself. Because for years, we have been saying to this community and to all our communities that every community counts, every community matters, and that we are committed to delivering health services here. And this investment means that we're able to do so today, we're able to do it for future generations. And on behalf of the community, we thank you. I would also like to recognize that today we have the board chair of the Central East LHIN, Lewis O'Brien, who himself sees the bigger picture and the system that we're serving. And so, Lewis, please come join us today.
Good morning. On behalf of the board and the staff of the Central East LHIN, thank you for including us today in this very important announcement. Bonjour à tous. Au nom du conseil d'administration et le personnel du RLIS du Centre-Est, merci de nous avoir inclus dans cette annonce importante aujourd'hui. The Central East LHIN board first endorsed this project long before my time in 2011, and we've been watching it and helping it and fostering it ever since, and we're certainly very happy to celebrate this wonderful next step in the redevelopment journey of Bowmanville Hospital. The Durham Northeast and Durham West subregions of the Central East LHIN have the fastest growing populations in our LHIN, and we're thrilled that this capital investment will provide redevelopment and expansion to this integral site of the Lakeridge Health family and indeed of the LHIN healthcare system, as Valentine pointed out. Every day across the LHIN, we are witness to the dedication and commitment of frontline health service providers, many of whom are here joining us today, and their leadership, who are focused on meeting the healthcare needs of their patients and improving the health of their communities. I would like to thank Minister Hoskins for recognizing the staff and leadership of Lakeridge Health and allowing them to continue to do their work in a modern, expanded facility that will meet the needs of this growing community. Thank you. And as you've heard, we've had many supporters, not the least of which is Mayor Adrian Foster, who's been a staunch supporter of this project almost from the very beginning. And so I'd like to invite him up to say a few words. Mayor Foster.
It's not the heat. I'm all right. Don't worry. So there are a couple things I need to do. Firstly, the really important is I need clarification. Your staff meetings, you have people squeezing into the room to. Where's Andy Allison, my CAO? Andy, I just want you to. So things that I have to say, Mr. Minister. Firstly, I put this tie on purpose. This is my Batman tie. As you will all know, Batman is a superhero, and today, Mr. Minister, you are a superhero to our community. And MPP Anderson, you're his sidekick, to be sure. Robin, I don't know that, sure. 3 years ago, I was invited, to an announcement that happened in Scarborough. And that announcement laid the groundwork for what's happening today. But the announcement didn't guarantee anything. And the announcement didn't make anything easy. And yet, here we are. So we know it wasn't easy. We know it wasn't guaranteed. We know that a lot of work went on by an awful lot of people. So, Mr. Minister, to all involved, and so many people were involved, thank you. So we have tradition here in Clarington. The first, Mr. Minister, is rose petals. So when a minister or the premier comes to town with an announcement, we give them rose petals, and pink roses actually represent a note of appreciation and thanks. And I can tell you Minister Shkreli got rose petals when he announced Darlington. The Premier and Minister Del Duca as well got rose petals for the GO train and for the 407 extension. And by the way, Granville, you did not take credit for the weather on that cold December day. Mr. Minister, these are only appropriate. And lastly, a small token of appreciation from one of our newest businesses in town, and I must remember to tell you, do not allow this to roll around in your back seat or your car will smell like beer. Give that to him, great authority. So from our community to all of you who have been so deeply involved, this is so fundamental to who we are and what can happen here. Thank you.
That's okay. My name's Chris Coy. I'm the chair of the Bowmanville Hospital Foundation, and this is a great day for our community. I've lived in Bowmanville all my life. I was born in the hospital just before the 1950s wing opened. That was a great experience for my family, I think. I was one of the first patients, the first adolescent patient that was admitted to the 60s wing. I had my appendix out. I was admitted for 7 days. Obviously, length of stay was not an issue back in the 60s. I was working in administration when the 90s wing was built. That finished in 1991. 27 years ago was the last major capital campaign for this community. As has been mentioned many, many times, we have seen tremendous growth within our community. Our hospital is old, it's outdated, and it's overcrowded. We have an excellent healthcare team that's been mentioned several times as well. They are challenged daily to meet the demands of a growing community. They do a great job, but there comes a time when they need help, and that help has arrived today. There are many hospitals that require capital investment. We know that every area in the community is stressed to get capital investment when they need it, and it's a long process. I would like to take this opportunity to thank Minister Hoskins for recognizing and approving this project for Bowmanville. It's been a long time for us, and we know that there are many competing priorities within his portfolio, so thank you very much. The Clarington community and the Hospital Foundation would also like to thank Valentine Lovekin as chair of the board and the Lake Ridge Health Board of Directors, Matt Anderson and his team for making this project, the Bowmanville project, a priority, because we all know that they have many competing healthcare priorities within the Lake Ridge system, and we're glad that this day has come and Lake Ridge Health Bowmanville will receive this wonderful project. I would be remiss if I did not congratulate and thank Granville Anderson. The word that was used by Eric was relentless. That's absolutely appropriate. He has been our advocate every step of the way. He's worked with the foundation, he's worked with the hospital. If it wasn't for him, I'm not so sure today would have become an eventuality as soon as it has. He is, as one of the other ministers said, a dog with a bone. And when they see him coming, they hide because they know he's going to be asking for something for his area of responsibility. The Bowmanville Foundation is very excited and very proud to be moving forward and taking on this challenge of raising the community share of the funds that will be required for this project. This will be the biggest endeavor we've ever tried to achieve. We have a very dedicated board, we have a professional staff, But most of all, we have a community that no matter what we have fundraised for, has always been behind us. And we know that that will be the case today as this announcement is made. The Bowmanville Hospital Foundation, in partnership with Lake Ridge Health, will raise the necessary funds to see this project be successful in our community. Why? Because our community cares about this hospital, about our community health, and they've been waiting a long time for this announcement. One of the things that's very important to the community, and always has been, is its volunteers. And it's my privilege today to ask Evan Reed to come forward. Evan is a member of the Bowmanville Hospital Patient and Family Experience. And she's going to share with us some of the things that her family has experienced coming to Lake Ridge Health Bowmanville for their health care. Volunteers tell the story the best, and they always tell it like it is. So on behalf of this group today, I'd like to welcome Evan forward to tell her story about Lake Ridge Health Bowmanville.
Thank you, Chris. I appreciate it. I am proud to be a patient and family experience advisor here at Bowmanville Hospital because this is my community hospital. When my family has an emergency, we come here to the emergency department at Bowmanville Hospital. When my husband recently needed cataract surgery, I brought him here to Lake Ridge Health's Regional Center of Excellence for Eye Care. Each time we've been to Bowmanville Hospital, my family has experienced amazing care provided by the talented and compassionate teams who work here, and we're grateful for them. As a volunteer advisor, one of my current roles has been to help patients and families complete a real-time survey about their experience in Bowmanville's hospital, including the emergency department. From what I've observed, I can tell you that today's announcement is fantastic news, not only for my family, but for everyone living in East Durham. Having newer and more modern facilities at Bowmanville Hospital will help Lake Ridge Health provide enhanced care and improve access for more patients and families in Clarington and surrounding areas. I believe that this redevelopment will definitely improve not only the quality of my life, but also for the growing number of older adults who, like me, have chosen to spend their retirement in this vibrant community. On behalf of us all, thank you for your work.
Thank you very much. And our patient advisory panel, I don't know if everybody's familiar with these. This is something that was started a couple of years ago, where wonderful volunteers like Eve Ann spend time with us and help us to answer some of the tough questions that we face in our healthcare system, all the way from tasting the food that we serve to our patients, to designing flow within our emergency rooms and everything in between. So thank you very much, and thank you for coming. And it's not the easiest thing in the whole world. You did it with great grace to stand in front of all these cameras and talk to all these people. Thank you very much for doing that. So on behalf of the entire Lake Ridge Health team, I want to thank everyone for being here with us today. It certainly is a tremendous partnership and cooperation that got us this far, and we're very excited about our next steps. The support of our partners, including, of course, the Ontario government, the municipality of Clarington, the Central East Lynn, and our foundation, has been absolutely vital to this project, and we are very pleased that we have had the opportunity to recognize their support today. To Minister Hoskins and MPP Anderson, thank you for being with us today. We greatly appreciate your government's investment in the Bowmanville Hospital, your commitment to this community, and the healthcare programs and services that it needs most. As to echo what you've heard today as well, a special thank you to our entire team, our volunteers, our staff, our physicians, all the people who really make this thing move forward. Now, Mr. Hoskins, who was so complimentary and bang on, really, in his comments earlier. This is Well, so this is the third time that I've had the privilege of having Minister Hoskins come to one of my hospitals to announce a major project. And one of the things that he talks about, and he said it implicitly today, and he said it explicitly many times. At the end of the day, as a physician, he knows that the bricks and mortar are one thing, but really what makes the hospital is the team of people who serve our community. And that's what makes the difference. And in Bowmanville, we are so fortunate with such an amazing team. This renovation and expansion will provide modern facilities for all of our team to provide excellent patient experience and care for our entire community. While today's announcement is certainly an exciting milestone for everyone, we look forward to groundbreaking, to the construction, and to ultimately seeing the opening of our new state-of-the-art facility as it comes to life and supports our community. So thank you, everybody, for coming today. Please, I know it's getting warm in the room, but please stay if you can. We are going to cut a cake, and just before we do that, I'm going to ask all of the speakers to come back up for a couple of photos. And I think, Minister Hoskins, we ran you a little bit longer. You were intending to stay for a few minutes to take some questions and to spend a little bit of time with us. We're still good on that, okay? I looked at Minister Hoskins, but I really looked to the back of the room because we all know who the boss is, absolutely. So we're good to hang around for a few minutes if you're able to do that. Thank you very much for joining us.